Geç. मैं पैक कर दो 2 मिनट ये वाला बस आज वो आएगी
So you're mute. So you're on mute.
So if you can come on the video, we can start.
Dr. Raj, your video is not on. So please unmute it.
Dr. Raj, can you?
Hello.
Yes, can you make your video on?
It is on.
No, it is not.
Can you not hear me?
We can hear you, but not the video is not here. You have to click on when I send you a request.
Yeah.
Yes,
Is it? Can you see me now?
Yes. So is it the time, Nitu? Can we start?
Yes, sir. Yes, sir. Please start.
You say 3, 2, 1, and I start.
Yes, sir. Please start. Three, two, one, start.
Hello, everybody. I'm back, Dr. K.K. Agarwal, with one more academic feast. This time, summarizing on a therapeutic approach towards immunity with focus on COVID-19. Ever since the COVID-19 has come, the Ministry of Ayush has come forward with defined recommendations on their perspective of immunity. There is a need for us to bring out a consensus statement from modern medicine. For this, I have with me an expert with me, Dr. Raj B. Singh. He is the head department of respiratory medicine, Apollo Main Hospital, Chennai, since 1989. He did it undergraduation and post-graduation from Madras University, MRCP, FRCP, and then FRCP again. Executive Committee of GINA, the Global Initiative for Asthma, the Global Initiative for Obstructive Lung Disease, WHO Advisor Prevention and Control of Chronic Respiratory Diseases, the Governor of ACCP, member of Medical and Technical Options Committee of the UNEP, on the editorial board of many journals, started Asthma Foundation of India, and started Chest Foundation of India. Welcome to our show, Dr. Rajbir Singh.
Good afternoon, Dr. Agarwal. Thank you very much for having me in this show.
And you are watching Chat with Dr. KK. That means Dr. Rajbir Singh in conversation with myself on therapeutic approaches to the immunity. I want to start with a simple thing is before I ask you to give a 5 to 10 minutes of overview on the subject. Is there something called immunopause? When we talk about menopause, andropause, can we define a term called immunopause? At that particular time, these are the criteria that your immunity is gone, naturally or artificially. We do have premature menopause, we do have surgical menopause, we do have iatrogenic menopause. So similarly, is there a concept immunopause, that your immunity, specifically the cellular immunity immunopause, is there a concept like that? Dr. Rajbir Singh.
Sorry, I couldn't hear that very well. I'll just put this on.
So I said, I want to redefine. I said we have hormonal menopause. We have andropause in men. Is there a possibility of an immunopause? That means artificially, drug-induced, disease-induced, or age-induced, your immunity gets low? And if yes, how do you define it?
the level of immunity to diseases will actually wax and wane over the years. And as we age, the immune system actually reduces in its efficiency. So that is well known. So people in the old age group are especially susceptible to a number of respiratory infections as well as other infections. And this is further compounded by the fact that many older people also have other diseases like diabetes, hypertension, and other cardiovascular diseases, which can also um, encourage the development of respiratory infections. So I suppose that that particular term I'm not familiar with, immunopause. So I think that's something I've learned today. But I think it's a very valid term. It's probably acceptable in people of the old age group.
So I'll divide them into two, cellular and humoral. Instead of going into innate and adaptive immunity, I'll go more towards humoral immunity and cellular immunity. And when I talk to cellular immunity, because this virus basically involves the cellular immunity at the cellular level, whether it is ACE or ACE2 receptor, whether it is angiotensin 1, whether it is gamma neuron, gamma interferon, whether it is interferon 1, whatever, whether it is NLRP, at every level, it is working at the level of cellular immunity. And most of our immune boosters are also working at the level of cellular immunity. So is there a way, first of all, to find out that my patient is immunodeficient? Because we have, how do we find out that your immunity is low?
Immunity actually, to find out, I mean, if people have obvious immune deficiency, they will have low immunoglobulins. And this would have been recognized by the fact that such a patient would have had several infections, maybe fungal, maybe viral, maybe bacterial infections of different sorts over the years. At any given point, the immunity can actually reduce for a variety of reasons. Stress, for instance, lack of sleep, or lack of adequate nutrition. So all these will uh, produce a temporary lapse of immunity, which allows infections to take place. I think all of us are familiar with the fact that when we are overworked or overstressed and we lose sleep, and then we are especially prone to develop a cold. So that is due to a temporary loss of immunity. A more lasting, a chronic loss of immunity will be shown by the number of infections which we develop from time to time.
So I think one thing we have now, take it as a take-home message from what Dr. Rajveer Singh has said. If you have repeated infections, so all those people who says every change of season I get infection, or they say I get repeated infections of respiratory infection, think somewhere maybe your immunity temporarily is getting lost, whether it is stress, whether it is sleep, whatever it is, you are catching normal respiratory infections too often. How to remember that your security of the house is so weak temporarily that the intruders, the thieves enters your house and you say every 1 month there is a theft in my house. It indicates that your immunity or a security in the body is low. Now, coming back to the role of cellular immunity, suppose I want to talk about vitamin C, vitamin D, but I want to talk about zinc. At what level they work? At what level their deficiency reduces my immunity? I specifically focusing on D, zinc, and vitamin C.
Well, if you have a deficiency of these vitamins and minerals, you will be prone to develop infections. Your immune levels will be low, and there will be a variety of other symptoms as well. However, the deficient state um, is often not achieved because there is a wide range of foods which we eat, which will usually have sufficient supplements of these materials. So unless we have a very specialized diet, I suppose some vegans might have um, potential to develop a deficiency if the diet is not balanced, and if you're avoiding certain food for whatever reason, then you can develop a deficiency. But what we are essentially interested in is to see whether, apart from having a real deficiency state, are we having a relative deficiency of vitamins, which has not been recognized, in fact, for over many years? I think it was in 1970s that a chemist named Linus Pauling, who incidentally got a Nobel Prize for chemistry, he suggested that a massive amount of vitamin C would actually prevent you from getting viral infections. And if you do get an infection, this enormous excess of vitamin C would reduce the number of days that you would actually be suffering from the disease. Now, this was actually poo-pooed at the time, and people really didn't follow that. And a lot of studies were done which partly disproved that. But there was something to support the fact that this excess vitamin could actually be helpful in the fight against infection. So it is not merely deficiency that we have to look at, but we have to look at relative deficiency, whether what we should be having is more than what has been generally recommended to correct vitamin deficiency. So deficiency is definitely, like vitamin C deficiency produces scurvy as we know it, and that will definitely encourage people to have more infections.
So coming back to again vitamin C. So when we talk about relative deficiency, or even if I take there is no deficiency and you get cough and cold, and people do say take 500 milligram morning and evening. Some people in ICU are also giving a very heavy dose of vitamin C in pneumonia to act against, to reduce the severity of pneumonia. What is the mechanism of action of vitamin C?
Well, vitamin C has a number of activities at the cellular level, at the cytokine level, and in the immunological basis. Now, we do find that when we develop an infection like a pneumonia, the vitamin C level in the blood reduces. This is an indication of it being used in the immune process. So before an infection, you would require a certain amount of vitamin C to prevent an infection. But once you develop an infection, you need a much higher level of vitamin C to actually overcome the infection. This has been shown in studies which looked at levels of vitamin C in the blood before and during an infection. Whether it really protects people is not clearly proven, in the sense it's very difficult to have a controlled trial to see whether excess dose of vitamin C would actually protect you from an active viral disease. But certainly, once you get an infection, it seems to help you to overcome the infection more quickly.
So if I have to give a preventive dose and if I have to give a therapeutic dose, what is the difference?
See, the preventive dose would be approximately 500 milligrams of vitamin C a day. This is much more than the recommended 200 milligrams or thereabout for most people. But 500 milligrams has been shown to be slightly more protective in among people, especially the elderly, those who smoke, those who are exposed to air pollution, and I think that would include almost every one of us. So all such people will have an increased need for vitamin C to protect them from infections. So 500 milligrams a day should normally be enough to use as a preventive. But if you have the first signs of a viral infection, maybe increasing it to even 1 to 2 grams per day would probably be appropriate.
So normally when we say in a virus, this virus stays in the body for 9 days. And the day 3, 4, 5, 6 are the time when we develop pneumonia. So do you think that we continue this high dose for say at least day 3, 4, 5, 6, or we continue it for a longer period of time? Or we continue till the virus is replicated and then
It
come back
depends.
to 500 milligram again?
It depends on the duration of the illness. Some people actually overcome a viral infection very quickly in a matter of 2 or 3 days. And such people, maybe you can reduce the dose to um back to 500 milligrams once there is no fever and once the symptoms abate. But there are some viral infections, and there are some people who develop these viral infections who continue to have um, fever and other respiratory symptoms for a much longer period, maybe a week or 10 days. In such people, it would be prudent to continue the higher dose for about 10 days till all the symptoms have reduced, and then maybe reduce the dose back again to 500 milligrams a day.
So once a patient crosses day 9 in COVID-19, we
Yeah.
know virus is non-replicative, but if their C-reactive protein is still high, that means inflammation in the body is still persisting, and they have a low-grade fever, which is 99 or 100. And I'm not talking, and in such cases also, if I need to take care of the fever, do I need to continue the high dose of vitamin C?
That might be for a different reason. See, in COVID, what we find is that the infection itself, where the virus is reproducing, multiplying, and actually there's a stage of viremia, is only in the first 4 or 5 days. And after that, the virus is actually um, die and they don't reproduce anymore. But there are a lot of viral elements which are still circulating in the body, and that triggers a cascade of inflammatory mediators which can produce what we commonly refer to as a cytokine storm. So that is manifested as an ongoing fever, an increasing breathlessness, development of ARDS, and ultimately respiratory failure with a need for ventilatory support if the patient is really unfortunate. So this is a second phase of the disease where there is no actual infection. So the immunity here is not to overcome the infection, but the immunity is actually has gone wild at this point and is actually damaging the body. And here the emphasis will be to reduce the inflammation. And here again, vitamin C has been shown to have some benefit in reducing the level of inflammatory mediators circulating in the blood.
So the second point we have learned is number one is that you need to take vitamin C 500 milligram as prevention. When it comes to treatment, the dose can be as high as 2 grams. Most of the people will require 500 morning and 500 evening. It should continue till the inflammation is there in the body. The marker can be C-reactive protein, but definitely it should cover day 3, 4, 5, 6, the time. Day 3 is the time when you get pneumonia on the CT scan. And day 5 is the time when your pneumonia becomes symptomatic. And by that time, if your C-reactive protein is persisting, which is an indirect marker of IL-6 and fibrinogen, which is an indirect marker of persisting inflammation in the body. Indirectly, it will also have a clot formation because there may be a micro thrombosis and micro angioneogenesis by the time. Continue vitamin C in a high dose. And once you can see that the signs of inflammation has gone away, you come back to 500 milligram. Remember, in a post-COVID phase, the masking is still to be continued. Once you have recovered from COVID, we don't know whether you will get a reinfection. We don't know whether you will get a H1N1 infection. We don't know whether you are prone for other viral illnesses. Normally, a virus, once enters, protects you from the second virus for some time. But the nuclear capsid of this virus, it inhibits the interferon 1, which is supposed to protect you from some other viruses. That protection may be lost. Therefore, you need to continue vitamin C even after the post-COVID state. How long? The time will tell us. But at the moment, we say continue it for 3 to 6 months. So coming back to vitamin C, I now just want to add on to some more vitamin C in pediatrics, pregnancy, antenatal, and elderly. Are there any differences?
Differences between vitamin C and
Only vitamin C in pediatrics age, pregnancy, elderly. I'm talking about special groups.
Yes, the special group like pregnancy obviously will need a little more, and in children you don't need that much. But it really depends on. Um, Sorry, I'm just.
Go ahead.
It depends on circumstances, but 500 milligrams should usually be sufficient to meet with the requirements of any of these special groups too. Now, the question of how long to continue it beyond an acute infection, that's a very good question. And I think this is really not very clear how long we should use higher doses. But I think 500 milligrams a day is probably a dose which we can continue practically lifelong. Because one of the big advantages of vitamin C, unlike other vitamins like vitamin A, for instance, vitamin C is water soluble and can easily be excreted by the kidney. And unless you have some kind of renal stones or some other problem, it really, there is no harm in giving even excess vitamin from what we actually need. So, as long as there is a possibility that the 500 milligrams a day is going to be potentially protective, I would suggest that we continue with that dosage indefinitely.
So coming back to natural sources of vitamin C, amla, we have santra, mosambi, we have lemon. So I don't think so they can ever cover the high dose of 1 gram or 2 grams. So therefore, supplementation is the only answer as far as COVID is concerned. Am I right?
Right, right. Yeah.
So don't, we do have that you can take from natural sources, but when it comes to acute COVID inflammation, there is no way you can achieve that type of a dose from the plants, whether they are citrus plants or they are natural amla. It cannot give you a dose which you are requiring for. Now coming back to synergistically with vitamin C, we have the role of zinc. What about the zinc requirement of zinc, deficiency of zinc, and again the role of zinc in the inflammation?
In inflammation.
Yes.
Well, in the
When
case
we
of
talk about therapeutic approach to the immunity, apart from vitamin C, what are other important factors?
um, I think overall a balanced diet, which makes sure you have sufficient calories and sufficient protein, is probably one of the key requirements. I think once you're malnourished for whatever reason, you are much more prone for infection. So the immunity will depend on a balanced diet, which not only is inclusive of vitamin C or other vitamins, but essentially adequate protein and calories. And this will have to be uh, taken in a kind of form which will be utilized well by the body. There is some suggestion that animal protein may not be uh, recommended, but I think since all the vital amino acids are found in animal protein, there's no real um, direction on whether people should become vegetarian or non-vegetarian. There are some reasons why health-wise vegetarian or even vegan diet may have some benefits. But apart from that, the other vitamins like vitamin A and D in particular also have a role in protecting you from viral infection. So this is one of the recommendations now is to take supplement of vitamin D. However, one word of caution that vitamin D, unlike vitamin C, can be taken in excess and can produce problems in the sense it can produce calcification in different places, produce renal failure, and so on. So I think one has to be careful about the dose of other vitamins. So it shouldn't go beyond a certain recommended dosage.
So when we come back to, we have talked about natural resources, and when it comes back to IL-6, we know very well that interleukin-6 is inhibited by estrogen, and we know phytoestrogens are there, and we know that soya is a phytoestrogen. And we also know that this virus causes inflammation in the small GI, And we also know that protein is absorbed from the smaller intestine. Therefore, we do get protein deficiency and a protein losing diarrhea in such cases. Do you feel that soya is a good substitution? It's like a non-veg. It's like all amino acids. It carries a phytoestrogen, reduces C-reactive protein, IL-6, and fibrinogen levels. So when it comes to high protein diet, can we add soya into our diet?
Um, well, yes and no. I think some people are a little bit concerned about the estrogenic effect of soya. So I think if you take all your proteins from the soya source, you'll probably end up with a kind of excess estrogen problem, gynecomastia, and all that among men. So so men particularly have to be a little cautious about the amount of soya that they are using. They can supplement it with other things like leguminous vegetables like peas and dal and things like that. Um, some people prefer to take some eggs as well. Egg whites, particularly, is a very good source of protein. But people who do not take egg, also who are strict vegetarian, will have to confine themselves to these kind of supplements. And there is also whey protein, which can be sometimes used as a supplement. Soya, of course, is an excellent source of protein, and it can definitely be used in some quantity. Excessive quantity, however, due to its estrogenic effect, could have problems for men.
So, okay, now I come back to again vitamin D part of it. In vitamin D, normally we say that Indian 85% of the people are vitamin D deficient. We also know vitamin D is an immunomodulator. We also know that vitamin D upregulates the ACE2 receptors. The viruses downregulates and it upregulates. It corrects the angiotensin 2 mechanism, and it corrects the protective natural protective phenomena in the lungs. And so what is your recommendation for vitamin D during, before, and after the COVID-19?
Well, I think I would consider COVID as just one of the many infections that we have always been exposed to. And even tuberculosis has been shown to be more likely to be vitamin D deficient. And therefore, vitamin D supplementation, unfortunately, has become necessary. One reason being our exposure to sunlight is greatly limited. Now, most people work indoors, most people travel in closed vehicles. So, I think vitamin D deficiency is quite rampant, and as you quite rightly point out, we need to take supplements of vitamin D. However, that can promote excessive calcium uptake and produce um, calcification in a number of soft tissues, producing problems. So we do have to be cautious about the upper limit of vitamin D that has to be followed as well. Um, Vitamin D deficiencies usually manifest as osteoporosis and other bony manifestation, bone pain, and so forth. But it will actually be also promoting infections when you consider vitamin D deficiency.
So when so apart from vitamin D, so we need to have vitamin D on a daily basis. You will recall our ancestors used to say that once in a year, at least for 30 days, you must go for a Shahi Snan near the river and spend 40 minutes in doing vitamin D bath, and after that take a calcium rich food. And if you see that all our rituals where marriages take place, they are linked to the marriage seasons are linked to those times when you need to spend time in the sunlight. And if you can't, supplement is the only answer. And in this particular COVID-19, the treatment is incomplete without vitamin D. Coming back to the role of the third, which is zinc. What is the role of zinc in the management of COVID-19?
Zinc has been clearly shown to be protective from infections, and therefore it has been widely recommended. Um, the quantity of zinc which is needed is a little uncertain, but one supplementary zinc tablet or capsule, which can be used in a multivitamin form, should be sufficient for everyone. Zinc deficiency um, may not be that common. I think with zinc deficiency is common among people who have very strict dietary restriction. Um, but I think supplementation with zinc in the form of one multivitamin capsule with the zinc, extra zinc in it will probably be sufficient.
So zinc is always also working at the level of cytokines. It's working at the level of viral replication, viral entry, and the
That's
role
right.
of virus inside the cytokine. So it also works at different stages of cytokines. Therefore, zinc is also inevitable in the management of COVID-19. So three chemicals and three vitamins which have played a significant role. To the extent in my practice of COVID, most of the people say these three they have already started. Now tell me what else to do. It has now become a household name in terms of CADA from Ayush department. Vitamin C, D, zinc has now become a household name as far as prevention during and after treatment is concerned. And these are the three hormones, these are the three vitamins and minerals which require probably a lifelong because we don't know how long the immunity will last. We don't know whether 2020 COVID-19 will come or not. So we don't know. Apart from that, what else to do for immunity development? We have vitamin C, we have zinc, we have vitamin D, we have proteins we have talked about. What else are needed to build up the immunity? Good sleep we have talked about. Stress-free life we have talked about.
Yes, I would think that apart from considering it as immunity build up, I mean, that suggests that our immune system in the body is being influenced. And apart from that, I think there are general health principles which will promote the protection from infection. Of course, it's all the hygienic things that we have been following now, social distancing and wearing masks and all that is protective. But I think certain social norms like spitting in public and those kind of poor hygienic practices should really be curbed. Secondly, smoking and air pollution are definitely known to promote more infection. And smoking is certainly in our hands, and I think avoiding smoking is very important. Pollution, to some extent, we can avoid by moving, but that's all not very practical in most occasions. But I think we can use our influence to bring about legislation against polluting industries and polluting vehicles. Uh, the other thing is exercise, and I strongly believe that regular, healthy exercise would also protect us from infection. Having said that, excessive exercise actually will lower your immunity to diseases. So if you just run a marathon or something for several days after that, you can actually have a greater chance of picking up an infection. So moderate exercise taken more regularly, at least 4 days a week, would also be helpful in preventing infection. And above all, a kind of a relaxed lifestyle and a relaxed attitude will be very helpful. I think living in constant fear could actually be very counterproductive and may in fact predispose to infection rather than protect you.
Now that was, dear viewers, we have discussed about general immunity and immunity in old age, immunity in the children. And in the next 20 minutes, let's say take up the question answer section from people who have talked about. This is Mushtaq Maulvi who is asking that how to increase immunity in old age. Apart from what we have told, anything else to be taken?
Um, Old age being,
60 plus. Anything else
yeah.
to be added, or is it the same as anybody else?
Well, I don't think you should consider old age as being a special sort of situation. I think it all depends on your frame of mind. As long as your nutritional intake is sufficient, what you should really be looking at is uh, keeping yourself active so that physically and mental activity will protect you from a number of diseases. So physical activity will involve at least a brisk walk every day, or if you're capable playing a game or something, this will protect you in many ways. And I think once the muscles start weakening and you reduce your level of movement, once the legs start weakening and you start spending more time sitting or lying down, I think that is the stage in the old age where infection begins to creep in more frequently. So, physical activity I would strongly recommend, and keeping your musculoskeletal system strong and active. Secondly, I think the nutritional intake is often dictated to by other diseases like cardiovascular disease and diabetes and hypertension and so on. So there is a tendency to restrict quite a lot of nutrients as well, in which case you may have to compensate either by taking other nutritional food or by supplementary food. Now, when you take other nutritional food, what I mean is like fresh vegetables and fruit, but then you'll find that some fruit have too much sugar and some vegetables are not available, or some vegetables are not recommended for some cultural reasons and so on. So there are several restrictions which prevent you from taking the right balance of food. And the chronic diseases which often accompany old age will also have to be taken into account when you are dealing with nutrition. And again, keeping your mind active will also be helpful in protecting you from diseases in the old age group.
So one question has come is the dose of zinc in various situations.
Dose of
Zinc as a supplement.
zinc, yeah.
What should be the dose of zinc in a normal supplement?
Not, the normal amount of zinc in a balanced diet is usually sufficient. But in order to increase our immunity, there are zinc supplements being given in the form of multivitamin or zinc reinforced multivitamin capsule. So one such capsule per day is more than enough.
So coming back to this was Dr. Khetriwal who was asking this question. Then there are many questions on ivermectin. I'm not touching it because that is going to be a 5 p.m. separate seminar. You can join this. And then preventive immunoboosting vitamin D. We have already spoken about this. Then our diet.
Ivermectin is not, ivermectin is not an immunoboosting thing. It is given in order to prevent you from developing strongyloids infection when you're taking steroids, which is part of the treatment for COVID.
So they were talking about the preparation Immune C plus. Yes, it contains all the three we are talking about. And how to improve your immunity power, we have discussed. My diet is only taking rice and curry, and I do not do any physical workout. He says what to do. Sudhakar, that my diet is only rice and curry. What do I do?
Well, that's certainly not a very good diet, or the level of activity also has to be increased. I would suggest that first of all, you have to make up your mind. I think you first have to be determined to change your present lifestyle. And I think that would certainly be very helpful as the years go by. And the first thing is to make yourself more active, at least go out for a walk every day for maybe 30 or 40 minutes. And as you get used to that, you can increase the speed and distance. And in the diet, you should definitely include a lot more vegetables and maybe add a few fruits also, especially if you don't have diabetes. So I think that addition will definitely make you a little more energetic and make you less prone for diseases, not only infection, but other chronic non-communicable diseases as well.
This is Mateen Patel. I have come across most of my COVID-19 patients have low vitamin D levels. Does deficiency of vitamin D patient makes more prone to COVID-19? Mateen ji may not be, because 85% of us are already deficient, but definitely vitamin D deficiency can make the pneumonia worse. but does it predispose to a to a COVID-19 infection? We have no evidence as on today. Then how long to continue vitamin C prophylactically? Professor has already told us lifelong. This was Dr. Megha Gulwala. Uh, then he says, what about your, this is Dilip Kumar. We take citrus fruits every day. Still we need a vitamin C. He has already told that vitamin C coming from citrus fruits may not be sufficient in dose. Therefore, you may need a supplement at least in the COVID era. Then this is Kanthavar Shantakumar Shenoy. Good afternoon. I just want a clarification on the role of zinc in building immunity, especially with the patient affected and not affected as a preventive measure. Can you answer that?
Uh, Zinc specifically has been shown to have a role because zinc deficient states have made people prone for infection. So this is why zinc has become an important part. Now, taking excessive zinc does not actually protect you any more than a person who has a normal level of zinc. So I wouldn't recommend more than a modest amount of zinc supplementation in your diet, just in case you have a zinc deficiency in the normal diet that you're following. So, which is why I suggested that you take one uh, capsule with the zinc in it as a supplement daily, and that should be more than enough uh, to compensate for any deficiency. By taking 4 or 5 capsules of zinc tablets or capsules is not going to help you anymore. In fact, that can produce other problems. So I think one a day is more than enough for any potential zinc deficiency.
So if you have a zinc deficiency, you can take a capsule which contains all the three compounds, that's vitamin C, vitamin D,
That's
and
right.
zinc into it. Role of omega-3 fatty acids in COVID-19 prevention.
What fatty acid?
Omega-3 fatty acids.
Omega 3 fatty. Omega 3 fatty acid has also been recommended for a number of health related things. So it is usually found in fatty fish, certain types of fish which have a lot of fat content in it. So cod liver oil was used in the olden days as a supplement that contains omega-3 fatty acid, and nowadays capsules which contain omega-3 fatty acid is also uh, available. Most of it is from animal sources, so vegetarians may find it a little difficult to get omega-3 fatty acid, which does not have a non-vegetarian origin. But that has again been found to improve immunity against infections.
So as far as the immunity is concerned, I'm going to take the last question and then I'll come back to, because your specialty is respiratory medicine. I may spend 10 minutes on respiratory update as far as COVID is concerned for the benefit of the listeners. And my last question is, Dr. Jungru has said that I am a medical doctor and at the moment my day is zero. I haven't got COVID-19. Can you summarize what should I take as a doctor? Do I need to take same as a patient? Do I need to take more? Am I more likely to get high viral load if I get the infection? So do I need higher dose than a normal person?
The dosage is far less important as a doctor than the usual precautions that one must take. I think we as doctors are often less careful when we are dealing with patients informally, like in the house or in a social situation, or even in our own clinic rather than in the hospital. In hospital, there are some kind of ways of seeing patients. We wear our masks, we wear our eye protection, we have social distancing procedures, and hand hygiene, and all these things are in place in hospital. In other situations, we may be letting our guard down, and that's why I think when we are in that kind of situation as a doctor, it's very important that we maintain the same sort of hygienic practices that we would have in a hospital. And that is far more protective than just increasing the amount of vitamin C or D or whatever. I think the normal amount that is recommended to the patient is enough for the doctors as well. The doctors will really have to be concentrating on making sure that they, whenever they treat patients, and any patient should be considered as potentially COVID positive, because that's what I have found. Many people are asymptomatic and they later on find to be COVID positive. And so every patient that we see will have to be considered as being potentially infected.
So coming back to the last 5 minutes, can you update us anything new, what's happening in the field of COVID care as far as respiratory care is concerned? I'm not talking about GI and other manifestations. In the
Yes.
field of COVID care, what anything which has come new in the last couple of weeks?
Well, since the onset of the disease in around March in India, we have learned quite a bit. And I think initially there was a huge amount of interest in a number of new drugs, like tocilizumab, for instance, and that has fallen by the wayside. It was quickly clear that this not only did not help people, but in fact it promoted infections, and therefore we have given up using that in our hospital. And other than that, the other antivirals like oseltamivir was obviously quite useless. Remdesivir also is now being questioned whether it's really that effective or whether it's potentially harmful. So remdesivir, I personally do not use widely in all our patients. The only two things which have been found to be really necessary and effective are the use of dexamethasone or its equivalent steroid and anticoagulants. So these two are used in all patients who require even the lowest amount of oxygen, and this is definitely helpful. All other medication and things are mainly supportive. And another thing that we have been thinking of is whether we should intubate and ventilate patients a little earlier in the course of the disease. Previously, we found that people could withstand hypoxia very well, so we waited for the oxygen saturation to go down 80, 75 before we thought about intubation. But now I think there is some evidence that waiting too long will actually produce lung damage, and therefore that can be prevented by earlier intubation and earlier ventilation. But we keep learning new things all the time, and I think the cytokine storm and the onset of ARDS usually is a bit of a bad prognosis, but with our new ventilatory setting of using less pressure and higher flow rates of oxygen, we're able to save more patients nowadays than we did in the first few months.
So let me sum up what Dr. Rajbir Singh had chatted with me, and based on that, A, charity begins at home. B, all my medical doctors viewer who are watching this program, start building up your immunity first. First take care of yourself, then take care of your family. And once you take care of yourself and your family, you will automatically take care of your patients. That's the second thing. Therefore, first look for, are you taking enough immunity boosters or not? Are you deficient in vitamin D, C, or zinc? Are you taking normal supplement which contains amino acids, which contains omega-3 fatty acids, which contains vitamin C, vitamin D, and zinc? If not, start taking it now. Also, believe, are you still doing a universal masking or not? Enough evidence that if you have a universal masking, and if your immunity is good, if you're taking if you're taking immunity booster supplements, and even if you get an infection, it will be mild. So people who indulge into universal masking, add on to immunity booster, it becomes a synergistic effect, and you may be taken care of. That's another thing. And if you still get infection, it may be likely that it may be a high viral overload. In that cases, as a doctor or as a high risk individual, you may require Oral anticoagulation, if you are a home care, then dabigatran or equivalent drug, or if you are in a hospital, enoxaparin or a equivalent drug, you may have to. And you may have to start a steroid early enough to pick up pneumonia. Remember, day 3 is the time for pneumonia. Therefore, if you want to start oral anticoagulation and if you want to start a steroid, this has to be on or before day 3. After that, it may be every day will add fire to your lungs. So I'm going to end by saying charity begins at home. Look after yourself. Look after whether you are immunodeficient or not. Find out in your family everybody is taking supplement or not, and then find out what is my risk, and if my risk is high, am I likely to get inflammation? Get out your baseline CRP done. If it is between 1 to 3, that means you have insulin resistance, you may have a fatty liver, you may have a metabolic syndrome, you may have underlying atherosclerosis. In that particular situation, specifically if your LDL is also high, and when there is a fire, the LDL get infused, you end up into a wide grade inflammation all over the body called immunoinflammation, further called thromboinflammation, thromboimmunoinflammation. Therefore, make sure that you take steroids and you take anticoagulations early. Let me thank Dr. Rajbir Singh, an expert in this particular field, to be here with us. We will be happy to answer all your queries, even if you have, because you are watching it on our YouTube, you are watching it on MedTalk's website, you are watching it on my Facebook. If there are any questions, me and Dr. Rajbir Singh will be happy to answer you. So let me thank Dr. Rajbir Singh to be here with us. Wonderful talking to you. Wonderful chatting with you. That's
Thank
all
you
for
very
today.
much, sir. Thank you very much for having me in this program, and good luck and God bless you all.
We'll be back with one more seminar. Till that, stay tuned. Namaskar.
Namaskar.